Hi everybody, it's Helen Birch here. Welcome back to my YouTube channel. In today's video, we're going to be unpacking signs and symptoms of vaginismus. So first of all, what is vaginismus? Vaginismus is a condition that causes significant distress and discomfort for many women. It's a condition that results in the tightening of the vagina during intercourse, making penetration painful or impossible. It is estimated that vaginismus affects around 6 to 17% of women and it is one of the most common causes of painful intercourse. In today's video, we will be unpacking the signs and symptoms of vaginismus, as well as its causes, diagnosis, treatments and cures, and also strategies for coping with its effects. So first of all, I'm just going to start by just talking about what is vaginismus. So vaginismus is a condition that affects the ability of a woman to have sexual intercourse. It is characterised by the involuntary contraction of the muscles around the vagina, making it difficult or even impossible to have intercourse. It can also make other activities that involve penetration, such as inserting a tampon, very uncomfortable. Vaginismus is a complex condition with both physical and psychological components, and it can cause significant distress and can interfere with a woman's relationship with her partner. The severity of the condition varies from woman to woman. For some women, the muscles around the vagina contract so strongly that penetration is impossible. Other women may be able to insert 1 or 2 fingers, but find intercourse too painful or uncomfortable. It is important to understand that vaginismus is not a sign of lack of desire or arousal. In fact, many women with vaginismus may experience strong desire and arousal, but are unable to have intercourse due to the physical effects of the condition. So next we're just going to talk about what are some of the causes and also some of the risk factors of vaginismus. So the exact cause of vaginismus is not known. Many experts believe that it is a combination of physical and psychological factors. Physical causes of vaginismus may include having some damage to the pelvic floor muscles, and this could be due to childbirth, surgery or some other trauma. It can include infections such as yeast infections, urinary tract infections, or also some sexually transmitted infections. It can be a result of having allergies to condoms, lubricants, spermicides, or some other form of substance. And it can also have psychological risk factors for vaginismus, may include fear of pain associated with intercourse, anxiety about performance or having anxiety or a poor body image. It can cause you to have negative beliefs about sex or your sexuality. And it can also be caused from having a history of sexual abuse or some form of trauma. So it is important to note that not everyone who experiences these risk factors will develop vaginismus. Many women with these risk factors are able to have healthy and satisfying sexual relationships. So next I'm going to talk about what are the signs and symptoms of vaginismus. So the most common sign of vaginismus is pain or discomfort during intercourse or other activities that involve penetration. And this can range from mild discomfort to a severe burning or stinging sensation. Other symptoms may include having difficulty inserting a tampon. You may have a feeling of tightness or tension in the pelvic floor muscles. You might have difficulty if you're using a menstrual cup. You may also have difficulty when having gynecological examinations. You can have fear or anxiety about just the idea of penetration. And then, of course, there is painful or uncomfortable sexual intercourse. So, sorry, one second. It is important to note that vaginismus can present differently for each woman. Some women may only experience mild discomfort or tightness, while others may experience severe pain, which means that penetration is completely impossible. So, how do you get a diagnosis of vaginismus? If you are experiencing pain or discomfort during intercourse, then it is important to see a healthcare provider. A healthcare provider can help diagnose and treat vaginismus, and the diagnosis of vaginismus is based on physical and psychological evaluation. Your healthcare provider may ask questions about your medical history, sexual history, and any psychological factors that may be contributing to the condition. Unfortunately, they may also perform a physical examination, but this is more just to check for any physical abnormalities or infections, and mainly to rule them out. So, what are the treatments and cures for vaginismus? So, there is no one size fits all treatment for vaginismus. Treatment plans are tailored to the individual and may include a variety of approaches. So, common treatment for vaginismus at the moment includes pelvic floor exercises, and these exercises really help strengthen the pelvic floor muscles and improve the ability to control them. And there are loads of pelvic floor exercise videos on YouTube. I will link some in the description box below. That's really good for you. Secondly, education. So learning about vaginismus can help to reduce the fear and anxiety about intercourse. There is also cognitive behavioural therapy, CBT, and this type of therapy can help to reduce fear and anxiety and also improve communication between partners. There are also medical treatments. In some cases, medications such as muscle relaxants may be prescribed to help relax the pelvic floor muscles, and you can also be given things such as dilators to insert. There is surgery, so in very, very rare cases, surgery may be recommended to help mainly improve the function of the pelvic floor muscles. So, what about some coping strategies for vaginismus? So, living with vaginismus can be challenging and really distressing. It is important to remember that you are not alone and that there are coping strategies that you can use to manage your condition. So, here are some tips for coping with vaginismus. So, tip number one is really to educate yourself. Learning about vaginismus can help to reduce the fear and anxiety. And I also have some videos linked to vaginismus and also some blogs, which I'll leave the links below for you to educate yourself on. Secondly, talk to your partner. Open and honest communication with your partner can help to reduce feelings of shame and embarrassment. Thirdly, practice relaxation techniques. So things such as deep breathing, meditation, some form of yoga can help to reduce stress and improve your overall well-being. Finally, seeking professional help. So talking to a therapist or a sex counsellor can help to address any underlying psychological issues that may be contributing to your vaginismus, many of which you will subconsciously not be aware of. So what about sex therapy for vaginismus? So sex therapy can be a really useful tool in the treatment of vaginismus. A sex therapist can help to identify and address any psychological triggers that may be contributing to the condition. This can also help to develop a plan to help you and even your partner become more comfortable with sexual activities. Sex therapy can also help to improve communication between partners and reduce that feeling of shame and embarrassment. So hypnotherapy is an incredibly effective way of addressing your worries, anxieties, fears around vaginismus and painful sex. The subconscious is not logical, but is purely reactive and behavioural. It is where all our learned and sometimes our limiting beliefs and behaviours are. And this is where the blocks that we live are stored, and this is where hypnosis can really get in and do its work, getting rid of those blocks. So hypnosis is deeply relaxing and restorative, and we can encourage the mind and the body to completely relax and to realign. Once we achieve a relaxation response, it then becomes possible to combat negative thoughts and fears with positive ones and focus on what is achievable rather than the opposite. So anything that you can imagine and you can create can be created in the subconscious. So the potential benefits are huge. So with hypnotherapy, you are able to reframe those negative thoughts and feelings associated with painful sex, and then it really gives you that feeling of being in control of your body. So overcoming the fear of penetration. So one of the most common causes of vaginismus is the fear of penetration. And this fear can be caused by a variety of factors, such as negative beliefs about sex, fear of pain, or a history of trauma or abuse. And it is important to understand that this fear is normal and that it can be worked through with the help of a trained professional. So a sex therapist can help to identify and address those underlying psychological issues that may be contributing to the fear. Using sexual freedom hypnotherapy techniques, we are able to get to the root cause of that fear, alter your perception of it, and create a brand new sexual blueprint for you. Hypnotherapy will allow you to build your communication and connection, and this is also paramount to good sexual experiences. The sessions will address communication and connecting with others, but most importantly, reconnecting with yourself and your own desires. Sex therapy will also build your enjoyment and permission for pleasure, which is essential for a satisfying sexual encounter. You can then take ownership of your own sexuality, your own body, and regain that control over your vagina. So how can you manage some of the side effects of vaginismus? Living with vaginismus can be difficult, and it can cause a variety of emotional and physical side effects. It is important to be aware of these side effects and to seek help if needed. So common side effects of vaginismus can include depression, anxiety, low self-esteem, and difficulty communicating with your partner. If you are struggling with any of these effects, it is important to seek support from someone such as a therapist, a counsellor, or another mental health professional. So vaginismus, in conclusion, is a condition that can cause significant distress and discomfort for many women. And it is important to understand the signs and symptoms of the condition as well as its causes. Diagnosis, treatments and cures, and strategies for coping with it will also improve how the effect it has on you. So if you are struggling with vaginismus, it is really important to seek help from a healthcare provider or a sex therapist. If you would like any of my help, then you can contact me free for an initial consultation to learn more about vaginismus and how, working together, we can manage its effects and, in most cases, completely eradicate the effects of vaginismus so that you can have pleasurable, pain-free sex. So thank you very much for watching. Speak soon. Bye bye for now.